Hi everyone. In this video, I am going to discuss about health promotion model given by Nola J. Pender. So for those of you who are new to my videos, I am Professor Dr. Rohini. Currently I am working as principal in Institute of Nursing Science and Research, Malabar Cancer Center, Talasheri. Malabar Cancer Center is an autonomous institution under Government of Kerala, and it is present in a place called as Talasheri, which is in Kannur district in Kerala, India. So if you are a person who are interested to watch videos related to nursing, especially nursing research, nursing theories, nursing management, nursing education, etc., you can subscribe to this channel so that you will be able to watch the videos as they are being uploaded. Without wasting much time, let us move on to the topic of the session, that is health promotion model. So, as I just told you, health promotion model is actually given by a theorist named Nola J. Pender. She was born on August 16th, 1941, and the aspiration to become a nurse actually turned out in the case of Nola at the age of 7 years, as she was inspired by the care given to her hospitalized aunt by nurses. And she was celebrated as an author. She was even celebrated as a professor emeritus of nursing at University of Michigan. And this particular model, that is the health promotion model, was given by Nola J. Pender in the year 1982. Coming on to her education aspect, she completed her diploma in nursing from Illinois, and then she did her master's degree in human growth and development from the same hospital at Illinois. And in 1969, she completed her PhD in psychology and education from Northwestern University. And her master's, she also undertook a master level work in community health nursing at Rush University. So we find her career growth progressing from diploma nurse to that level of doctorate, that is PhD. Uh, to discuss about her career, Pender had a lot of experience being as a staff working in medical, surgical, and pediatric departments at Michigan Hospital. And one of the most, special thing about Pender is that she was a person who had experience of around 40 years of teaching experience, teaching various levels of students, ranging from undergraduate, graduate, postdoctoral students, etc. She was really a very great teacher, and she became the president of Midwest Nursing Research Society, later on American Academy of Nursing. Then she had various positions like associate dean for research at University of Michigan. Post retirement, she was the advisor for health research both nationally as well as internationally. And again, she was the distinguished professor of nursing at Loyola University School of Nursing in Chicago, Illinois. She has numerous awards, okay, numerous awards. And let me tell one point about Pender. She has a lot of publications related to her health promotion model. So the various awards we find that she has received. She was a recipient of Midwest Nursing Research Society's Contribution to Research Award, Honorary Doctorate Award, American Psychological Association's Award for Contribution to Nursing and Psychology. And again, she received the Teacher of the Year award from University of Michigan School of Nursing, Lifetime Achievement Award from Midwest Nursing Research Society, and no wonder that she is named as a living legend, because people usually professionals are not given this title as living legend. Only those people who really contribute significantly to the profession of nursing, only they are labeled as legend, living legend. So one among that living legend among us is Nola J. Pender, who was named as a living legend of the American Academy of Nursing in the year 2012. So, such a great person we find in her introduction to theorist. At least I want my students to remember, just like she was, her education as well as career. If you're going to really look into it neutrally, it ranged from starting from a diploma degree, ending up with a PhD, and going beyond that as professor emeritus in nursing profession. At the same time, if you're going to look at her career, one thing which stands out in Pender is she was a great teacher. teacher for more than 40 years, not teaching only undergraduate or graduate, doctorate and postdoctorate level of students. And no wonder she has received so many awards. And to mention specifically or something significantly in her life is she has received the Lifetime Achievement Award. In addition, she is being named as the living legend. Now let's move on to the beautiful model which is being given by Pender. So what is this model believing? You know what is HPM? HPM stands for health promotion model. So what does this model believe as such? Okay, what is this model, in a nutshell, what is it talking about? Health promotion model believes that every person, each person has unique personal characteristics and experiences which affect subsequent actions. I think all of us will agree to this point, that none of us are, comparable to others. Each of us are unique in our own way. We have our own characteristics, we have our own unique experiences, which usually affects our, the prospective actions, is it not? Like, I have my own experience, I have my own personal characteristics. You have your own characteristics, you have your own experiences. So that is what is a basic belief in health promotion model, that every person is unique. Each person is unique in two things. One is your own characteristics, your own experiences. Number two, it indicates that certain preventive health measures and it can be taken up, and it describes nurses' critical function is to help patient prevent illness by self-care and bold alternatives. Let me tell you, this particular model, if you're going to see health promotion model, it is from the name itself, you know that it gives more importance to promotion of health. It is not curing, it is not treating, it is not rehabilitating. It is talking about promotion of health, which means something, we do in order to keep ourselves healthy, something we do in order to prevent ourselves from certain diseases. Those things are actually called, that is the focus of health promotion model. What is the, what is the beautiful point in health promotion model is, theorist believes that nurses can make a significant contribution in the life of a patient by focusing on the preventive aspects, so that this patient will have better health, or an optimum health. So that is in a nutshell about health promotion model. Only 2 points are there. It believes that every person is unique, we have our own experiences, we have our own characteristics, and somebody can influence me. Who is that? A health professional. A health professional can influence me so that my health can be promoted to an optimum level. Now let us look into this model in detail. Okay, main thing what students should remember is that it is a very, very easy model. Okay, only thing you have to study for exam is you have three columns. Or that there are three important headings in order to study health promotion model. So if you remember that main three words, it will be really, really, really good, because you get the key point from these 3 points, and it's such an easy thing to remember this. What it is? Number one is the first column, or the first important point is individual characteristics and experiences. Just now I discussed to you that we have our own characteristics, we have our own experiences. So individual characteristics and experiences is 1 point. Number two is talking about behavior. Okay, what is this talking about? We have to bring a change in the behavior of another person, right? So the second column is focusing on what? Behavior. Behavior specific cognition, behavior specific affect. I'll explain that in the following slides. Okay, so two things are there in behavior. Behavioral specific. One thing is mind, that is cognition. Another one thing is feeling, behavior specific affect. So behavior specific cognition, behavior specific affect. Number three is there is a behavioral outcome. That is the, that is the outcome, or that is the product what we really want, that is behavioral outcome. So let me tell you, there are, once again I'll repeat it, there are mainly three important points which you should remember in health promotion model. What are they? Number one is what? Number one is individual characteristics and experiences, that it talks about one person unique. Number two, it talks about behavior. Behavioral specific, again two things are there. What are they? Cognition is there, affect is there. And what is the last one? If these two things are going on well, what will come out? Behavioral outcome. Let us look into the picture which is given by Pender. You find, as I told you, there are three headings here. One is individual characteristics and experiences, that is number one. Number two is behavioral specific cognition and affect. And number three is behavioral outcome. So let us see one by one. So overall, when you see this, you may find, oh my God, this is little, it's appearing a bit complex. But believe me, trust me, it's very, very, very simple thing to study. Once you understand the basic concept, you will start to love Pender's health promotion model. Okay, so let us look into the first column, individual characteristics and experiences. So under individual characteristics and experiences, what has Pender put? Pender has said that there is something called as behavior and something called as factors, right? So there is a prior related behavior and there are certain personal factors. So let us look into that in detail. So the first one is individual characteristics and experiences. As we told earlier, Pender believed that every one of us, each one of us, we have our own set of characteristics, we have our own set of experiences, is it not? Now, when, like, if you're going to look at a person, why a person is, say, smoker, why this person has become a smoker, there are a lot of reasons why a person is a smoker, maybe a chain smoker, maybe there are, there are prior related behaviors are there are certain personal factors why this person has become like that. Okay, we have our own characteristics, we have our own experiences, we have our own prior related behavior, our own prior related behavior. Maybe from his childhood he has found his parent, say for example father, being a smoker. Okay, so this boy is used to the fumes of that smoking. Okay, and he doesn't find it as anything abnormal to smoke cigars. Okay, so that may be one of the reason. That may be one of the reasons. So maybe there is a prior related behavior. Maybe there are certain factors. What are those factors? Factors can be, biological factors, psychological factors, socio-cultural factors. Now, biological factors, say for example, age, gender, body mass, pubertal status, aerobic capacity, so and so. Lot is there, strength, agility, or balance. So, a lot of physical factors. Physical factors, a person, say a boy who is a teenage, a boy who is, say, in around 15 years, maybe there is his curiosity to know what is smoking, his curiosity to know what is the taste of smoking a cigar. Okay, maybe gender, especially in a country like India where nowadays you find even girls become smokers, but still, gender has an effect on that. So certain things like that, those are personal factors. Number two is psychological factors. Psychological factors is my own perception. My perception of my self esteem, self motivation, how much I'm competent, personal competence, perceived health status, my definition of health. This will be different from one person to another person. I hope all of us agree, you all of you will agree with me. Self esteem is not the same for you and for me. For me, my self esteem is different. Maybe my perception of health is different, your perception of health is different. For me, maybe as long as I feel that I don't have any symptoms of disease, I'll say that I'm healthy. But for you, it may not be the same. For you, maybe you will be checking your all your lipid profile, you may even do what is say, you are once in every 3 months, you keep checking your blood values, and as long as everything is found to be proper, then you will say that you're healthy. Right, so our definition is different. My definition of health, my self-esteem, my motivation is not the same for everyone. So that comes under personal factor. Okay, so that is why people are different, that is why people are doing different varied type of health behaviors are being observed in the society. So Pender is going into deep to study about that. Biological factors are different, maybe psychological factors are different. Number three, socio-cultural factors. What is socio-cultural factors? The race, the ethnicity, the acculturation, the education, the socioeconomic background between one person and another person may be different. Right? It is not the same. So maybe the socio-cultural factors has made this person to be what he is today. Okay, maybe as I told you earlier, maybe this boy has seen his family, maybe his parent being a chronic smoker. He finds his say friends being a smokers. Okay, so what happens is all those socio-cultural factors. Maybe there are in certain cultures, smoking is considered to be very normal. So maybe, it's considered to be very normal. So if a person is going to come from, say, such a background where drinking alcohol or where smoking is considered to be quite normal, then that person will be like that, right? So For me, it may be a very wrong thing, but for another person, it's everything seems to be fine. So those things comes under personal factors. So what is Pender trying to tell us? Pender is trying to say that if you want to change the behavior of one person, there are a lot of things which you have to look into it. Just like that, see, let me tell you an example. If I am just going to give a health education to a chronic smoker, say for around half an hour, I am talking to a person who is a chronic smoker, and I'm telling this person, please stop smoking, nicotine. I'm talking about the, thousands of chemicals which are there in that cigar, how it can affect his lung, how he can end up with lot of problems, all those things I can give health education. But after 30 minutes, if you're going to find, there will be few people who will at least think about what I have said. But you can find certain people who just, ignore, smile, or mock at you and they will walk away. Okay, and you may have a doubt what is wrong. Is the problem with my health education or is the problem with that person? The answer is given in health promotion model. The answer is quite simple. People are not the same. Each one of us are unique. That person's socioeconomic background, that person's self, what is his definition of health, that person's, what is his level of motivation to stop smoking, how much he perceives this as a problem, his age, his gender. Maybe this particular person's age is very important. If you're going to talk to, say, around 40, 50 years, if you're going to talk to a person about this, maybe their perception will be entirely different from what you're going to talk to a, say, 17 or an 18-year-old boy who is a chronic smoker. So the theme is very, very simple. She is trying to teach us, if you want to change the behavior, please understand there are a lot of concepts which you have to look into it. One among that is individual characteristics and individual experiences. People are different, their experiences are different, their prior related behaviors are different. So just like that, if you're going to just talk to them, it, it is not mandatory that a person should change. It is not mandatory that a person should change. Okay, so that is what we try to understand by studying health promotion model. So when I deal with a client, when I deal with a patient, I should remember that this person has his or her own individual characteristics and experiences. So that completes the first column. So this is what Pender was trying to explain to us in this. They have their own prior related behavior. They have their own personal factors, which includes biological, psychological, and sociocultural. Now we are moving on to the second column. What is it? Behavior specific cognition and affect. So this is such a beautiful point, and this is where nurses can make a significant difference. We will try to understand how. Okay, so behavior specific cognition and affect. I want the students or those people who are listening to this video to look into the words given in the second column. So, two things are there: behavior specific cognition, behavior specific affect. So, this has a direct impact on motivation of change. If you really want to change a person's health practice, okay, I should understand that this person's, okay, factors, experiences are there. But in addition to that, this person has his own thinking, this person has his own feeling. Cognition is there, affect is there. Cognition is related to thinking, affect is related to feeling. Let us look into it. Now, say behavior specific cognition and affect. Pender again, she's such a very thoughtful person. She again divided that into so many things. Let us see what they are. Perceived benefit, perceived barriers to the action, perceived self efficacy, activity related affect, interpersonal and situational influences. Such an interesting thing. You're just going to, stay with me and try to listen very carefully to what I'm going to tell. You will understand that it's such an easy topic to study. Okay, what is it? Behavior specific cognition. So these three things are related to cognition. What are the three things? Thinking about the benefit, thinking about the barriers, thinking about the self efficacy. There is one thing related to affect, activity related affect. And there are two influences. One is interpersonal, another one is situational. So first, let us look into about this cognition, that is perceived benefit, perceived barrier, perceived self-efficacy. It's very, very easy. Perceived benefit of action. Say, for example, I'm giving what to say. I'm giving a teaching. Let's talk again about the same example. I'm teaching or I'm giving a very motivating or an inspiring speech to a group of people, telling them to stop smoking. And I'm telling that, see, you can end up with peripheral vascular diseases, you can end up with, say, CAD, you can end up with cancer. When I'm trying to explain all these things, and if I'm going to say that if you're going to stop smoking, all these things will not come. Okay, so perceived benefit of action. Benefit is if I am okay, which means what is the action? The person has to stop smoking. If I am going to stop smoking, what is the benefit? We all know these are the benefits, but Pender put a word, perceived benefit, which means benefit really may be all these things, but what I believe is the benefit of the action. Am I completely believing that, okay, I will be saved from, okay, all these particular diseases? Or I feel that perceived benefit of action, that lady is talking something or irrelevantly. Okay, she will tell all these things, but that doesn't happen. Okay, so if my belief is going to be like that, then the perceived benefit of action is going to be less. So it's very important to know what is the perceived benefit of action by that person. So what is it? Very simple. What is the positive outcome, anticipated positive outcome that will occur from health behavior? Let me put it in a very another example. We all experienced a very pandemic, okay, a very scary pandemic, that is COVID pandemic. So people were asked to wear mask when they are going outside. Okay, all of us obeyed. I think 98, 99 percentage of the population, they obeyed and they sticked on to wearing mask. Why? Because if you're not going to wear mask, you will get a droplet infection and you will end up with COVID, right? You will end up with a respiratory infection. And the benefit of action is, the thing is like you will, otherwise what will happen is, you will end up with COVID and it can end up with ARDS and you may even die. So when I think about all those things, okay, wearing a mask is very important. So all of us, irrespective of our educational status, irrespective of our career status, irrespective of age and gender, all of them had a very better perceived benefit of action. So what happened when the benefit perception was found to be more, immediately we all started to follow that. So that is perceived benefit of action. When I do something, what is the benefit? If I feel that the benefit is great, I will go for that action. If I feel that the benefit is not much, I will not take up that action. That it is. That's simple. Next is perceived barriers to action. Like barriers to action is what is the three things are there. Okay. Main thing is anticipated barrier, imagined barrier, or the real blocks and personal cost of understanding a given behavior. When I tell a person to say stop smoking, okay, now what is the barriers? Barriers are nothing but very simple obstacles. What are the various obstacles which can come when I want to stop smoking? Maybe like one thing is anticipated thing is the pleasure which I receive when a person is smoking, the pleasure a person is receiving when he or she is, say, smoking. That pleasure, okay, will not be there. So there is not much, motivation to stop smoking. Okay, or it may be an imagined one, or it can be a real one. Okay, whatever is obstructing me from taking up an action becomes a barrier. So that is barrier, and that barrier can be perceived barrier. Okay, now barriers to stop smoking can be a lot of things, such like these things, like maybe the barrier is, as I told you, you don't get pleasure. Maybe you are afraid that the friends or the group, like they will start to mock at me. Okay, and maybe so many things like that. Okay, so those things are perceived barriers to action. Let me tell you something else. If as like for example, if I'm planning to start an exercise program, somebody is coming and teaching me about the importance of undertaking an exercise program, and then I know that the benefit of undergoing, doing exercise, very frequently will give me a very good health status. At the same time, there are certain barriers. What are the barriers? I may have to wake up, say, early in the morning, or I may have to spare, say, 20 minutes or 30 minutes only for walking or for doing some aerobic exercises. My sleep is going to be less. Maybe my time with my friends may have to be compromised. Maybe, I feel really lazy. Such things. So those things are barriers. That is not a real barrier. Those are anticipated barriers. Sometimes it can be imagined barriers, sometimes it can be the real barriers which is blocking me from undertaking an action. That is perceived barrier. Number three, perceived self-efficacy. So what is perceived self-efficacy is like self-efficacy. Efficacy means what? Efficacy means the ability to do something very properly is called as efficacy. What is self-efficacy? Ability of myself to do certain things in an efficient way. What is perceived self-efficacy? Perceived self-efficacy is my thinking of how much efficient I am in carrying out a particular activity. Like all of us, most of us at least, all of us, we have our own perceived self-efficacy. Like for example, when someone is telling us certain things and they are motivating us to do certain things, then we say, you see, my characters, I'll start things, but later on, I am not a very determined person. I may do for 1 or 2 days, and after that, I will not do. Okay, that is, I have a perception already. I may come with you for an exercise, say 1 or 2 days, but after that, sometimes you may not see me because I don't think I am a very determined person. Whereas there are certain people who are very, very determined. They're very consistent in what they do. Okay, irrespective of the situations, irrespective of whatsoever happen, these people, they will do certain things, and so their perceived self-efficacy may be very high. Now, when I am saying that you should stop smoking, there are certain people who take up decisions on the spot and who stick on to it because their self-efficacy is very high. They believe that they can do it. Whereas there are certain people who don't believe that they can do it. So that is a judgment of oneself, judgment of our own personal capability to execute a health promoting behavior. Once your self-efficacy is very high, then whatever may be the barriers, it is not going to affect you because your self-efficacy is very high. You know that for example, if I believe that I can do certain things, then that's it. I will go ahead with it, irrespective of the obstacles. Obstacles becomes very small when the self-efficacy is going to be very high. So when there is higher efficacy, barrier perception is found to be very less. It's interesting, right? So these three things, if you're going to sit back, relax, and think about, these three things are related to thinking. They all are related to cognition. What are the three cognitions? When someone is telling me certain things, it's not only for a health promoting behavior. For any such matters, if somebody is telling you certain thing, okay, why don't you come out? Why don't we go for an outing? Or why don't we go for a picnic? You immediately start to think, two or three things. One is, what is the benefit of going? Number two is, what are the barriers? Is there any other problems if I'm going to go? Number three is self-efficacy. Will I be able to manage if I go? A lot of work is there. Will I be able to manage this and that? Self-efficacy. All things are taking place in our brain. That is perceived self-efficacy. I'll just tell you the keyword. Perceived benefit is the positive thing which comes out by taking an action. Barrier is, what are the negative things which can be an obstacle to undertaking this action. Self-efficacy is how much I feel I am competent that I will be completing a particular health promotion action. That's it. So these three things are related to what? They are related to cognition. What is the next thing? The next one is perceived activity related affect. Activity related affect is something very, very beautiful. What is it? When the activity related affect is very high, a person will start to do that behavior again and again and again. But the affect, if it is going to be very, in a minimal scale, that person will not undertake that again. Like, for example, if you're going to say that you have to, coming back to, because you can only put such examples for health promoting behavior. Say, for example, you tell a person to do an exercise and this person is doing an exercise. Okay, say for example, he is doing an aerobic exercise. And say after 20 minutes or 30 minutes, the next day morning, he finds that he's having a lot of muscle cramps. Okay, and severe body pain is there because of that activity that is due to exercise. But and this person is saying, oh my god, hereafter I will never do this. Okay, because that activity did not give me a positive thing. That is what is my feeling. On the other hand, you can find certain people continuing exercises because they'll say that, okay, on the very first or second day you may have body ache, but when you're starting to do exercises regularly, you will start to realize that really your physical as well as mental happiness is going to increase. Definitely it increases, and scientific studies have proved that there is, you really feel really, really good by doing exercises. So if the activity related effect is found to be positive, okay, like Activity related is, say, after doing exercise, if I feel good, then there is nobody, I don't expect anyone else to tell me again and again. I will keep on doing that. Okay, how many people we find who stick on to gym, or how many people we know who really, without a break, these people they do exercises consistently because their affect is good. Affect is feeling. I feel good after doing an activity, and so I continue to do it, right? So those are cues for, continuing a health promoting behavior. So four things we have discussed. Number one is cognition. Cognition related three things we discussed. One is the benefit, second one is barrier, third one is self efficacy. All these three things are perceived. Number four is activity related affect. So let me tell you, benefit should be more, barrier should be less, self efficacy should be more, activity related affect should be positive. If everything happens positively, definitely this man is going to do that particular health promoting behavior. Next is two more things are there in the second column. Okay, what are they? Interpersonal influences. What is interpersonal influences? Interpersonal influences is like we have our primary source of interpersonal and secondary source of interpersonal influences. Primary is like the family, the close friends whom I have, all those people will come under interpersonal influences. Now we find, as I told you earlier, there are certain groups, there are certain cultures where certain things are considered to be very normal. Considered to be very normal. Smoking is considered to be normal. Taking alcohol every day is considered to be normal. Okay, having an extramarital affair is considered to be normal. So there are certain groups like that. Okay, so for such people, okay, if a person who is belonging to a particular group where smoking is considered to be normal, you you cannot change that person just like that to quit smoking. Whereas a person who is coming from a family where the family members are telling that smoking is really bad, smoking is really injurious to health, if that family members are going to talk like that, then maybe there is a scope, because even I am going to talk the same thing to the person. Okay, and his family, his friends, everybody are telling, please stop taking alcohol, or please stop drinking alcohol, please stop smoking, please don't use drugs. If those people are also going to belong to the same group, then the work is very easy. Work may be easy. Okay, because interpersonal influence is very, very important. Okay, like that is what Pender said, that three words, that is norms, social support, modeling. Norms is what is my family expecting from me? What are my close friends expecting from me? Social support is again, it's very important. Like the area, the place where I work, how are those people? If all the people who are working with me are smokers and drinkers and alcoholics and drug addicts, then influences like that. Okay, it's not very easy to change me. Okay, so it's very important that influence. Same way modeling. People, like, we learn a lot from other people. Okay, because if my role model is going to be a person who is going to be, very genuine, say a person who is very giving importance to, say, health, a person who is really giving importance to all sorts of values, etc., then automatically that influence will be there with me also. Okay, so that is very important. So interpersonal influence has a greater contribution, in changing the behavior of a person. Beautiful, right? That is how Penda has put it. Last one is situational influences. What are the situational influences? Situational influences are the perceptions of what are the options available, what are the demand characteristics, what are the aesthetic features of the environment in which health promoting is proposed to take place. What exactly is a situation? Say, for example, I am living in a place, in a residential area, where, I find people always going, everybody going for jogging early in the morning. Okay, when you every day when you see this, automatically I understand that okay, I can also go for that. Okay, because it is an I find it is found to be good day. I find that they all are found to be very happy after doing some jogging or after doing some exercise. The aesthetic features and other things are there. That is, what are the options available? If I have a lot of options, like either I can go for a party, or I can go and have a drink, or I can go and have a smoke. When options are more, a person's behavior will depend upon his self will. When options are less, when the situational influences are very less, then I have no other go. I'll have to go as per to whatever is the norm of that particular situation. You got it? So situational influences is like, especially the demand of a particular situation. The demand is going to be, you have so many options available. Maybe I can do anything with my free time, fine, I can be as and how I like. But if I have a lot of work, if I have a lot of responsibilities, then there is a way how we live, the situational influences. Okay, so all those things are something important which Pender has said in her health promotion model. So to just review back, we just discussed about two columns. One is individual characteristics and experiences. Another one is behavioral specific cognition and affect. Let me tell you, I'll tell only the keywords. Please try to, preview and just take it back. Individual characteristics and experience. Pender believe that every person, each one of us are unique. We have our own behavior. We have our own characteristics. Now, our own characteristics can be like personal characteristics, biological characteristics, my own psychological characteristics, and socio-cultural characteristics. Number two, she said that, so this is a base. Every person, even before I'm going to change that particular person related to health, I understand that this lady or this man, they have their own characteristics, they have their own past experiences. This person, they have their own biological, psychological, and socio-cultural factors, which means that is a base. Base is there. Okay, everyone, that base is there. Number two is behavioral specific cognition and affect. What is behavioral specific cognition is, this is the place where nurses can do a great role. What is it? Every individual, they have their own. When I am teaching something, when I am trying to change the behavior of a person, say through counseling or say through, empowerment or say through reinforcement, through health education, whatsoever may be the methodology, when I do certain things for the sake of a patient, every patient need not change. Because number one is they have their own characteristics and experiences. Number two is when I tell something, this person have their own mind and their own feelings. What are they? Number one is they have their own perceived benefits. They have their own perceived barriers to particular action. They have their own perceived self-efficacy, whether I'll be able to do this or whether I'll not be able to do this. And after doing a particular activity, what I am telling, what is their feeling? Are they feeling good or are they feeling bad? All those things are important. In addition, very, very important is personal, interpersonal influences and situational influences. Interpersonal influence is very important because especially the close friends, the family members, all of these people comes under interpersonal influences. So if the norm of a family, if the values of the family, if the expectations of that particular friends, the modeling, how the people with whom I relate, if all these people are going to be really good, if all these people are going to give importance to health, then automatically whatever another person tells, easily I will adapt to it. If not, it's going to be difficult. Similar to interpersonal influences, situational influence. Situational influences, what are the various demands which are there? What are the various options available in front of me? Okay, all those things are very, very important for me to decide and then to take up an action or not. Now, so what is the message from this? How can nurses do the intervention? Nurses, when we give intervention, I should understand that when I tell something, their own cognition is there, their own affect is there. I have to concentrate on this. What is that? Family, peer group, providers, what are their norms, what is their family structure, etc., and what are the situational influences. Number three, if everything goes on well, okay, if everything goes on well, what will happen? If their perception is good, if the affect is good, if the influences are good, then comes here this box. A person starts to get committed to a plan of action, then only that commitment comes. It is not when I say stop smoking, the person will stop smoking. No, it is not an input output model. It has a lot of factors like this. Based on this, a person can go into commitment, that is to a plan of action. But again, you find there are two more things, So this comes under the third column, behavioral outcome. So behavioral outcome will come only when there is commitment to a plan of action. And in between that, there is another villain over here. Okay, you have something called as demand and preferences. So let us look into it. So we are talking about the third column, that is behavioral outcome. What is behavioral outcome? The behavioral outcome is when a person starts to commit to a plan of action and starts to really take up certain changes or starts to practice the behavior what we are trying to tell him, that will turn into a behavioral outcome. So what is the goal of behavioral outcome? The goal is to stimulate a change in the behavior, maybe change in the behavior, maybe good diet, okay, maybe good exercise, maybe to stop certain behaviors like smoking or alcoholism or addictions, etc. Okay, now coming on to under the third column, we saw no three boxes are there. In that, the first box is what? Commitment to a plan of action. What is it? I will try to plan a strategy how I'm going to stick on to the schedule. Say, for example, weekly 3 days aerobic exercise, say for 20 minutes, or say weekly 2 days, say 30 minutes of walking. Okay, or maybe I'll cut down the sugars, or maybe I will try to reduce the intake of say non-vegetarian food. I will try to add more veggies to my diet, etc. Each one of our planning strategy will be different, but I'm trying to put up a planning strategy and I'm trying to stick on to it and I'm trying to work on that. That is called as commitment to a plan of action. What is the next thing? Immediate competing demands and preferences. Again, I told you villain is there. Even when I start to do with a plan of action, there are two things. What are they? Demands and preferences. What are demands? Demands are, certain situations over which I have very less control. Say, for example, a person is committed, okay, this person is telling that from tomorrow onwards, I'll go for daily exercise, say for 20 minutes. Okay, that is the decision. He has put a plan and is trying to stick on to that plan of action. But unfortunately, on the very next day morning, say for example, his spouse is not feeling well, or maybe his children are running a very high temperature, okay, and maybe or say one family member has met with an accident, so certain things when it happens like this, you automatically this person will not give much importance to exercise or walking or jogging or whatsoever, okay, because situation is in such a way that I have to give more importance immediately to take care of my family or to take care of the person who has met with an accident or hospitalization, etc., isn't it? So those are demands. When the situational demands are going to be very very high, then all these things will start to less. Okay, so that is what competing demands is over which I have very less control. Any person will have less control. Situation. When the demands can be more, and when the demand is at a very high level, people will not give any importance to such small, small things. Behavioral change, which you're talking about, a long term vision change, nobody will give importance to that. Beautiful, right? So that is competing demands. Next is competing preferences. What is preferences? Preferences is over which I have high control. Like, for example, I am saying that I'll add more veggies to my diet. I'll take more vegetables in my diet. Now, I have the choice which vegetable I should take. Okay, what is my most favorite vegetable? Should I add this or should I add that? That's up to you. That preference is over which I have a lot of control. Should I go for, walking in the morning or should I go in the evening? Should I go alone or should I go with my friends? Okay, all those things are preferences. Preferences are those things over which I have a lot of high control. Okay, so all those things are very, very important. The demand should be low, the preferences should be high. Only then a health promotion behavior commitment, right? That commitment, if it has to work out properly, the demanding situation should be less, the preferences should be high. I hope you got that point. Okay, so that is the third column, behavioral outcome. I'll just tell you, behavioral outcome is nothing but stick on to a plan of action. But when I stick on to a plan of action, there are certain situations over which I have very less control. That is my demand. Okay, that is my situation. Say, for example, loss of job. Say, for example, financial crisis. Say, for example, death of a loved one. Say, sickness of a loved one. All those things are situations where you don't give importance to small, small things. That time those things become very small. Okay, so that is demand. Preferences is when I can select from a lot of option. When I have a lot of preferences, maybe my ability to stick on to that plan of action will work out very very well. So that is what she has told in behavioral outcome. So if everything works out well from the first column, that is, what is the first column? First column is going to be individual characteristics should be good. Number two, the cognition and affect should be good. Situational influences should be good. Interpersonal influences should be good, demand should be less, preferences should be high. Everything works out very well, then this person is going to take up health promoting behavior. Health promoting behavior, which will end up with optimum well being, personal fulfillment, productive living, good quality of life, satisfaction in life, etc. 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 So, this is such a wonderful model which is talking about why certain people don't change, why certain people doesn't change to certain things. Okay, because it is a very, very complex thing. Human beings, as such, are very complex, and human beings, these many things are there. Okay, characteristics are there, experiences are there, prior related behavior is there, my thinking capacity is there, self efficacy is there, affect is there, influence is there, demand is there, preference is there. If everything works out well, definitely the person to whom you're going to give a health education, or the person to whom you're going to give a health talk or counseling or empowerment will work out. Okay, so it's not a very simple thing that somebody should change immediately when I tell certain things. That is what is this model teaching us in such a nice way. And I no wonder this lady Pender was she's being regarded as a living legend, because usually people think like, if I tell something, something should happen. But why it is not happening? What are the various factors related to it? She is really a great person to have thought of so many things, to have done studies related to so many aspects, and then try to put everything as a conceptual framework. Lots of respect, lots of respect, lots of respect to Nola J. Pender, because she has brought out this model in such a beautiful way. And most of the nursing research studies, especially based on preventive health studies, like in community health nursing, we find not only postgraduate students, even doctorate students, they try to put Pender's health promotion model as their conceptual framework, because it is such a beautiful model which can be used in order to bring out the outcome in a research study. Now, coming on to assumptions. So, assumptions, like it's very important that from exam point of view, students should study what are the assumptions according to each theory or according to each model. I'll tell you, studying assumptions is very, very, very easy in Pender's health promotion model. Okay, just sit back neutrally and just look on to what each point is talking about. Okay, the first one is it is saying that every person tries to regulate their own behavior. Number two, it is saying that individuals in all their biopsychosocial complexity interact with the environment, and we are trying to transform the environment, and we are being transformed over time. Two things happens. One is, the first thing is I try to regulate my own behavior. That is why Nola J. Pender said that every individual is unique, because we regulate our own behavior. Number two, she was telling that it's not only my own behavior, I try to interact with others, and I transform the environment, and in addition, I am also being transformed by the environment. Two things definitely happens, right? We influence people, people also influence us. We influence the setting or the nature, nature also influences us. Okay, so something like that. So that is the assumption, second assumption. And number three, she said that health professionals are forming a very important part of interpersonal environment. See, so far Pender was saying that in interpersonal environment, families and friends are coming. But now she is saying that health professionals are a part of which one? Interpersonal environment. So interpersonal influence we studied, right? So interpersonal influence, who has an upper hand? Health professionals has an upper hand. And that is where Pender is telling that maximum you utilize to the maximum, so that your influence is going to bring a change in the person's behavior. And self-initiated reconfiguration of person environment interactive pattern is essential for behavioral change. So it is not that I am just trying to change another person's behavior. There should be a self-initiated reconfiguration that is coming from the individual side. Only then there will be a change in the behavior. So it's very, very simple. Many assumptions are there. At least let us try to study four assumptions. Okay. The first assumption is we try to regulate our own behavior. Number two is I try to transform the environment, and I am also being transformed. Number three, I understand is health professionals are coming under interpersonal influences. But though there is an interpersonal influence, I have to change by myself. Self-initiated reconfiguration is very, very important. Now we are coming on to the end of the slide. Next is on proposition. Writing proposition is very, very, very easy in Pender's health promotion model. Start from the first column and come till the last column. Whatever keywords you have studied, no, put all those things and try to correlate that keywords with the outcome. For example, let us start with the first one. What is the first one? You remember in that picture we studied prior behavior and there are certain characteristics. You remember that characteristics, biological, psychological, and socio-cultural. What did Pender write? Pender just put an arrow mark. It's like, Pender is trying to say that prior related behavior, prior, these factors, all those things can have an effect on what? Health promoting behavior. Number two. Then she said that perceived benefit of action. You remember in the second column, under cognition, we studied about perceived benefit. So she's trying to link that. What is she saying? A person will try to get involved in the behavior when the assumption that benefit is more. If I feel that the benefit is more, I will try to involve in a behavior. That is what is going to be put here. Persons who are committing to engage in behaviors will if they know that they are going to get some benefit, they will start to commit to that behavior. No, like people who want to get selected in like police or navy or army or etc. like that, they have to have certain heights and they should have certain stamina and circumference and all those things. So these people, they will definitely involve in lot of exercises and other things because they know that the reward is great. Once they get selected, the benefit is great. So such things, when the perceived benefit is greater, if I feel the benefit is greater, I will start to involve in that particular activity. Number two, then she told, what is the next word we studied? Barrier. See there, she has put perceived barrier can affect the actual behavior. If my perception that the barrier is very high, if I'm going to think, oh, your obstacles are very, very high, then I will not get involved in a behavior. Next, what was the word? Self-efficacy. See there, she has given a statement for that. If I believe that the self-efficacy is very high, then there is a greater likelihood that I will commit to the action. Okay, that is good. So again, she has put, if there is greater self-efficacy perception, it will result in fewer barrier and more commitment to the action. Okay, all these things are very simple. Each and every word what we studied in the that diagram, no, you have to relate that with the health promoting behavior. Okay, each and every word. Okay, first one was characteristics and prior related behavior. Second one was what? Benefit. Third one is barrier. Fourth one is self-efficacy. What is the next one? Next one is when we are what to say, when positive emotions are affect. You remember perceived what to say, that affect activity related affect. So whenever the activity related affect is found to be positive, then again and again we will commit to that plan of action. Next, what are they going to tell? Interpersonal influence. If the interpersonal influence, the norm, the model, everything is going to be good, then there is more chance that the person will end up with health promoting behavior. Family, peer, healthcare providers, they're all going to be a source of interpersonal influence. Then she told situational influence. Situational influence can either increase the commitment or it can decrease the commitment. Then she said, if the commitment is found to be great, then definitely there will be health promoting behavior. Again, she said that the demand should be less and the preferences should be more. Very simple, no? Once you understand that all the concepts, you yourself can write the propositions. There is no need to by heart the propositions. If you have really understood the model, if you have really understood what each word is telling and how that word is can influence the health promoting behavior, you can write the propositions by yourself. And please do write like that. Okay, except for a research study where you want to properly put that proposition exactly like that. For an exam point of view, dear students, I'm just telling you, it's very simple. From the first column till the last column, try to correlate and try to write. Okay, nutshell, I'll tell you, characteristics, factors will have an influence. Benefit, if it is high, promoting behavior will be high. Barrier should be less, then the promoting behavior will be high. Self-efficacy should be high, then the promoting behavior will be high. Interpersonal influence, very good interpersonal influence will increase the commitment of action. Situational influence, depending on the situation, it can increase or decrease the commitment. Okay, activity related effect. After doing the activity, if I feel positive about it, then that commitment to the plan of action will be there. Then again, it is being said that the demand should be less and the preferences should be more. then health promoting behavior will happen. That's it. I hope it is clear. Okay, so that is about the propositions according to health promotion behavior. And so the yeah, this point is telling that when we are getting committed to an action, automatically there will be more incentives will be there. There will be better well-being. There will be better optimum life, etc. Okay. Now we are moving on to the strength of the model, weakness of the model, and then conclusion. Okay, what are the strength of health promoting model? We can say that it's very simple to understand. It looks complex, but actually it is very simple. If you really understand what each words tell, it is very simple model. Number two, this focus on health promotion. All the other nursing theories, if you're going to see, most of the nursing theories and models are concentrating on care of the patient. Like for example, Roy's adaptation model. If you're going to see, Levin's conservational theory model. In everything, you will find most of the theories are talking about treatment. Whereas here is one theory where it says that nurses can do a lot of wonders by being an interpersonal influence or an interpersonal change agent, okay, and trying to bring out that desired behavior. So it's highly applicable, as I told you, in community health nursing, and even it promotes the nursing profession's independent practice, okay, because it is focusing on health promoting interventions and health promotion educations. Now coming on to the limitation of the model, though we say that it is a good model, but still, most of the nursing models, if you're going to see, we talk about meta paradigm. I hope you remember what is a meta paradigm. Some definitions about person, health, environment, nursing, everything is needed. But in Pender's health promotion model, she has not defined any of the nursing's meta paradigm. Number two is I told you that it is simple, but still for some people it is complex. Okay, because you will have to really understand so many new words are there. You find affect is there, you find self-efficacy is there, you find influence is there, demand is there, preference is there. So a lot of words can be confusing to the reader. And it is this model, there nowhere she has given explanation that it can be used for a person who is already having a disease. So which means that it is mainly reserved for people for prevention of disease, not in the treatment of disease. So those are the weaknesses. But still, I'll tell you, when we compare the weakness and the strength actually, stands out in Pender's health promotion model. So now we are moving on to the conclusion. So health promotion and disease prevention can more easily be carried out in community than programs that aim to cure disease conditions. So health promotion model is mainly reserved to use in community health nursing or to use among people where you really wanted to prevent certain diseases. Okay, it's on the like disease has not yet occurred, but I want a change in the health behavior of the client. Okay, so I really want this person to change so that the person will have a better life and a better quality of life and optimum well-being. So to just summarize, I'll just tell you, we have discussed so far about Nola J. Pender's health promotion model. Pender is a wonderful person because she has done a great work, lot of publications, lot of awards. She is being called as a living legend by American Academy of Nursing, and she was working as Professor Emeritus. Okay, so she has got that reputation, such a great person. Lot of publications. Now coming on to her work as such, she says that there are three main headings are there. One is individual. Every individual is unique. We have our own characteristics. We have our own factors. Number two, she in the second column, she's telling that we have our own specific behavioral, specific cognition is there and affect is there. Cognition is related to thinking. Affect is related to feeling. Cognition, three things are there. What is the benefit? What are the barriers? What are the self-efficacy? And affect is when I do the activity, am I feeling good or am I feeling bad? Two influences are there: interpersonal influences, family, friends, health workers, and situational influences, which can increase or decrease the commitment. The third one is behavioral outcome. If there should be a behavioral outcome, I should stick on to a plan of action. But in that plan of action, there are two villains. One is demand, another one is preferences. Demand should always be low because I don't have control over the demand. Preferences should always be high so that I can have a lot of choices to select from what I should commit to a plan of action. If everything works out very, very well, then come on, that positive outcome in behavior can be observed. What are the assumptions? Assumptions she believes individually. Assumptions she believes that I can transform you and you can transform me. all such things. Proposition is very, very, very simple, and it's such an easy question to answer in the exam. You have to, once you have understood all the basic concepts, starting from the first column, try to relate it to the health promoting behavior. Strength of the theory, very good, because it's community health nursing, preventive aspect, nurses can do something. Weakness, lot of concepts are there, sometimes it appears very, very confusing. It can be used, she has not told about applying this particular model for a person who is suffering from a disease condition. So that's it, that is about Pender's health promotion model. I hope and pray that you have got a glimpse of what is Pender's health promotion model. And let me tell you, you can use it in your research studies, especially if you are planning to use an intervention, trying to trying to bring a behavioral change in the population. If that is the focus of your study, especially in community health nursing, if you're planning to undertake any such studies, you can use Pender's health promotion model. And n number of research studies are being published using Pender's health promotion model. So I hope you loved this health promotion model. It's a very good model which can be applied especially for health promotion and disease prevention. Okay, so thank you all for your patient listening. And I wish that this video is going to be useful for all the listeners. Thank you.